Hello everyone. Thank you for those words, Heather, and thank you everyone for being here today. I am one of the 1.4 million Canadians who has long COVID. A report released by Canada's Chief Science Advisor last week described long COVID as a mass disabling event, and my experience shows that to be true. As the number of long COVID patients grow, we need doctors who believe us, we need a strong public healthcare system, and we need sick days and financial support so we can recover. I got sick in January 2022 during the Omicron wave, and we will never know how many people got sick at the same time as me because the UCP canceled PCR testing right as it hit. This ended up delaying access to care for me and for many others. Like many people who now have post-COVID condition, my initial infection was considered mild. I was sick, but never hospitalized. But I never really got better. And a few months later, I started to get much worse. This is something very common for people with long COVID. My health declined over the spring, and by the summer, long COVID had completely upended my life. Long COVID has over 200 symptoms, and I have many of them. Deep, unrelenting fatigue, especially after any activity, dizziness and a racing heart, shortness of breath, brain fog and cognitive issues, painfully aching joints, nausea, sensitivity to light and sound, rashes and hives, new allergies and food sensitivities, hair loss, problems with vision, and insomnia, just to name a few. And there are also long-term concerns about blood clots and increased risk of conditions like Alzheimer's and Parkinson's. I used to be a very active person. I had a bike instead of a car. I was an avid cross-country skier, and summer doesn't start for me until Edmonton's outdoor pools open. But today, here I am in a wheelchair. I have trouble standing now for more than a few minutes. Like many wheelchair users, I'm able to walk a little, but my chair greatly expands my capacity to get around. When I stand, or sometimes even when I sit upright, my heart races and I get dizzy, a condition called POTS, postural orthostatic tachycardia syndrome, that many people with long COVID now have. And the effort of walking can lead to post-exertional malaise, a deep exhaustion that can be brought on by even the slightest activity. And not just physical activity, emotional and cognitive exertion can also bring it on. Through a rehabilitation clinic in the public system, I work with several different rehab therapists. My physio and occupational therapists help me maintain the strength I have and help find ways to adapt my life to my new low energy levels. I also have a speech-language pathologist helping me with cognitive function. I was once a voracious reader, but it now takes tremendous effort to even follow a short story. We usually have to end those sessions early because my vision blurs and I have to lie down from the effort. And what you see today is all adrenaline. My body will crash soon, and after this wraps up, and it's going to feel brutal. And this is true for many long COVID patients. We can seem all right in the moment, and we worry about being accused of faking it, but know that we're faking being well so we can be out in the world for a moment. You don't see us at our worst because in those moments we are bedbound and housebound, lying alone in the quiet dark, feeling tired but wired, unable to sleep despite our bone-deep exhaustion. And what you see of me right now is like the Instagram version of my life. You see the party, the trip, the going hard in sports. Tomorrow you won't see the hangover, the jet lag, or the concussion, all things that long COVID can feel like. It can make you feel crazy and make it hard for people to understand. I am so incredibly grateful for the care I get from the team of therapists, but it often angers me that it took so long and that other people I know are still waiting. I'm also grateful that I knew I needed to get care. It's one of the great tragedies of this pandemic that people have long COVID and they don't know what's happening to them. During Omicron, the narrative around COVID shifted from something to be scared of to something that was mild. And this led many people to believe that they didn't have long COVID, often because it shows up months later. And there has been no robust public education campaign on long COVID. If there had, people might have been saved from it because if you push through, you risk making it worse. When people try to get back to normal, they push through their exhaustion, but this triggers crash cycles so they don't get better and they get long COVID. We need sick days. People need to be able to rest when they're sick so they can get better. Another ongoing failure is doctors are not educated on long COVID. I've heard so many stories and have personally experienced doctors giving horrible advice and even completely dismissing long COVID. Others do believe their patients and desperately want to help, but don't have the guidance to know how to treat them. And these aren't personal failures, they are systemic failures. When I realized I likely had long COVID and started trying to access care, I was denied because I didn't have a PCR test because the UCP made it impossible for me to get one when I was sick. And this was infuriating because the clinic that I wasn't able to access was triaging patients and only accepting those with a PCR test because the demand was so high. It's absolutely absurd, but they were forced to do it because of lack of funding. And my care was further delayed because the clinic I then got referred to was shut down in August because the UCP stopped funding the long COVID doctor there. Nearly a year later, I now finally have an appointment scheduled, but I have not been seen. I have lost a year of my life waiting for long COVID treatment. And this is what people mean when they say our public healthcare system is broken. The care is excellent when you get it, but through deliberate decision by the UCP, it is hard to access, especially when you are sick. All because the government is not funding it and not respecting healthcare workers. And I have always been a strong public healthcare advocate, but nothing has strengthened my resolve like being sick. The testing and treatment I have received over the past year would have cost me hundreds of thousands of dollars. If I had to pay for that, I would have likely lost my home. And that is something so many people with long COVID are facing right now, even with the public healthcare system. On top of failing to provide healthcare people need, our government is failing to provide the social and financial supports we need. There is plenty of money for wages for corporations, but it's dried up for people with long COVID. There are at least 1.4 million Canadians with long COVID, and we have no financial support. AISH is difficult to get, and we know that the UCP, although they've re-indexed it, they are not raising it. Many people are not able to work and are worried about their finances, or they are still working and they are getting sicker and sicker. And this is a travesty. And I am so grateful for the organizations here today who are advocating for real solutions. The government seems to think the solution to these issues is to pretend long COVID does not exist, to pretend COVID does not exist, to privatize healthcare, to give quick access to the rich. My experience has shown me that the crisis in healthcare is manufactured. The system works, it's been starved of funding and people. We have the ability to give people their lives back, but we're choosing not to, and hoping the worst doesn't happen to us. The disability rights advocate and mother of the disability rights movement, Judy Heumann, passed away this month, and as I've been reading tributes to her, I've been struck by a couple of things. One, she was disabled by polio, which only disabled less than 1% of the people who were affected by it. Like COVID, the acute infection was nothing compared to the long infection, but now we have at least 15% of patients who have long COVID. This is a mass disabling event. We built a hospital for polio patients, but what are we doing for long COVID patients now? We also know that Judy's parents were Holocaust survivors, and so they didn't institutionalize her. They kept her at home because they were wary of what fascists had done to disabled people. And we are seeing a stark divide in our society right now, with anti-vax protests being linked to convoy occupations and the growing rise of fascism in Canada. We're living through a mass disabling event. At the same time, the right wants to destroy not only our public healthcare system, but any part of society based around caring for each other. And we need to strengthen our disability rights movement now more than ever. Taking COVID seriously feels like a radical act, and it should not be this way. We need to start recognizing it and start working to reduce the risk and address the harm. We need public education about long COVID so people know what's happening to themselves and the people around them. We need a strong public healthcare system that gives family doctors the information they need. We need to hire and support and keep more rehabilitation therapists for long COVID support. We need to give people sick days and financial support so they can recover. We are 3 years into this pandemic and it is not over. For some of us, it feels like it is just the beginning of a very long journey. And I'm so grateful for you all to being here today to join us. Thank you all for your support.